In this lecture, I want to talk about building a basic first aid kit, the sort of first aid kit that I advocate taking with you into the field. Now, there are people out there who believe you don't even need a first aid kit, as you should be carrying multi-use items that can affect first aid. While that is partly true, and we'll talk about those multi-use items you should have a bit later, I believe you should still carry at least the most important and useful items in a basic but relatively complete first aid kit. On the other hand, there may be people who go overboard and carry too much by the way of first aid, something which I want you to avoid if possible. So your first aid kit doesn't have to be bulging and too large, but we will return to some of these points a bit later when we conclude this video. The first step in building a first aid kit is to ask a question: what sort of injuries or medical conditions are you expecting out there? What do you expect to treat? What's going to happen to you? Basically, we need to tailor our first aid kit around treating those injuries and medical conditions you may likely face out there in the field. And I've identified 8 conditions that you may reasonably expect out there in the field as follows. Now, don't worry too much about the order, but it's perhaps arranged in how common or likely they may occur. But it's mainly 2 groups, the first 5 more common, and the last 3, perhaps you can call them the bonus conditions. Okay, so they're mainly 2 groups. And we'll go through the conditions: your cuts, abrasions and wounds like that. Any wounds where the skin's cut open or broken open. Splinters in the skin or other objects stuck in your skin. General infections which you have to be careful of and treat. Make sure you don't get infected by any other wounds. General pain. Of course, you can have pain, headaches, toothaches and any injuries and so forth. And sprains and broken bones. Fall over, twist your ankle and so forth. Then burns. You're dealing with fires, campfires, hot metal, hot water and so forth. Insect bites could be a problem. And lastly, food and water poisoning. You eat something or drink something bad. And we'll come back to this whiteboard at the end to summarise the first aid items we'll have to treat these conditions. Now let's have a look at the 6 main items for a basic first aid kit and the 5 good options you can add to the first aid kit to make it more comprehensive. And what you're going to have in the basic first aid kit is band-aids. Just normal band-aids. The most common injury is a cut finger. You work with knives, so there's band-aids. Gauze pads, number 2. You get these sorts of packets of gauze pads. Now, the best gauze pads actually have a sticky portion that you can stick onto skin like a big band-aid. I would still wrap it up in a bandage or cloth material. Now, these ones here don't have a sticky portion. It's just a gauze pad that goes on a wound. You wrap up with a bandage. And just in case if you don't know, bandages are not meant to go onto wounds. That's what gauze pads are for. And of course you have different size gauze pads, bigger ones as well. Have a few smaller ones and bigger ones. That's just a small one. And number 3, the bandage. You get different types of bandage, smaller ones, larger ones. There's an example there. Good to wrap up your gauze pads, sprained ankles, maybe broken bones with splints and so forth. Although for that you're going to use cloth materials and so forth. At least 1 bandage. The small ones are good for, like the arm doesn't use as much bandage, but a thicker leg you use more bandage, so at least a fair sized bandage like that. Then your antiseptic ointments and alcohol swabs and so forth. Or there's a handy little cream of antiseptic cream just like that, a very small tube. Number 5, a needle or pins. You buy a packet of needles, you get the smallest needle from the packet, perhaps the medium sized needle. They're also good for repair work, for thread and so forth, but they're used for digging out splinters from the skin. You don't use tweezers, you don't need tweezers, you want needles. And you can keep those in a first aid kit wrapped up in a small Ziploc bag to keep it nice and safe. And the largest needle in the packet you should also take, you can put elsewhere in your kit for repair work and so forth. And a pin is a good option. They're small pins, you stick things up on a board with the round head. They're very small and sharp. And number 6 are your painkillers, Panadol and so forth, and make sure you keep the use by date on the blister packets just so you know when they expire. Then the optional items. You've got burn cream, which I don't have here, but it's going to be a tube of cream obviously, insect bite relief and insect repellent, dressing and antibiotics. Now the 5 optional items here are options because often I won't even have these items for several reasons. They are items that you may not always need in every situation, and they may start to add bulk, maybe some weight, but more in terms of bulk to your first aid kit and your pack in general very quickly. And that could be a concern when you're packing a backpack and you need to carry a lot of other gear like shelter, food, water and so forth. Of course, if you can find handy small items in small packets and so forth, then that's fine. Now, for example, the dressing. The dressing is going to be something you put onto more severe wounds. Very good if you have a bigger, severe wound, but it's going to be like at least a package like that, if not bigger. You can buy packages about that big. And you know, as I said, it's going to add bulk to your first aid kit and you may not always need it. It's just the option in case you're worried about a more severe wound, you're chopping with an axe or something. Of course, things like bandages and dressing are made of cotton, so it's a great multi-use item to make char, to filter water, makeshift water filters and so forth. A tube of burn cream, which I don't even have here, is going to be like a big tube that can take up bulk and you may not even ever use it. I've never burnt, touch wood, I've never burnt myself out there. Murphy's Law says I'm going to burn myself and I won't have burn cream, but it can start to add bulk. The same applies to insect relief and repellent. They're normally going to be like sprays and roll-ons that are a bit bulky. They're going to start to add bulk, but of course there are different options. For example, here in Thailand, you can buy a very handy small tin like that, insect bite relief, just a cream, very handy. Here's an insect repellent lotion, but I don't like these sorts of packets because you get messy and so forth. You can buy those sprays and roll-ons, which are much handier, but they can start to add bulk. Now, as far as insects are concerned, it may depend on where you're going. If you know from experience there's going to be a lot of mosquitoes, for example, then sure, take at least insect repellent. When we went camping in the mountains, I was surprised by the lack of mosquitoes. A nice flowing river in the mountains was probably the answer. A campfire and smoke helps keep away insects. I wear long pants and a long sleeve shirt, and I prefer to sleep in a tent, all things that minimise insects. In cold weather, you may not have a big insect problem. As for antibiotics, there's something that may not be easily obtainable. They are supposed to be prescribed by doctors and so forth, but if you have them, I've got no problem popping a few in case you get sick in the stomach.